Hi, my name is Andrew Cuff. I'm a consultant physiotherapist for Connect Health, and also hold a various number of different hats in my working week. So I'm currently studying for a PhD at Manchester Metropolitan University under the supervision of Professor Chris Littlewood. I hold an honorary senior lectureship at the University of Bradford, teaching on red flags and postgraduate MSK conditions, and I sit on the board for the European Society of Shoulder and Elbow Rehabilitation. Alongside my working week, I also do some teaching, particularly around professional development for postgraduates and for people that are looking to upskill predominantly in red flags. So I run a half-day spinal red flags and systems thinking course, which the main aim really is to raise awareness of serious pathology, particularly around the spine, but then also just to look at different ways of clinically reasoning to pick up these weird and wonderful conditions that might come through your clinic, whether it be FCP or physiotherapy, whether that be a CAT clinic, or even in secondary care. So we talk a little bit about a reasoning mechanism that helps you pick these things up early. We talk a little bit around the governance that sits behind the serious pathology, which is really, really boring, but really, really important. And particularly, if you have got that person sitting in front of you, you want to know what to do next. We talk a lot about the importance of good pathways, refining your pathways, and some tips and tricks on how to move that forward. And then finally, we talk a little bit in depth around some of the clinical conditions that you might see in the spine. So we go through various things such as called equina and metastatic spinal cord compression, but also some of the bits and pieces that might be a bit tricky to pick up, such as AAAs, cervical arterial dysfunction, or things like central neurological pathology such as multiple sclerosis or transverse myelitis, that can sometimes make it difficult to see the wood through the trees. In the half-day course, we talk a lot about the theory. In the full-day course, we have an element of practical in there as well. So we go through some case studies. We also look at how to do a good neurological assessment, do a lot about how to do a good vascular assessment, and what does that mean within our clinical reasoning framework. And we broaden the pathologies covered somewhat. So we move away just from these serious pathologies, but also looking at things like fractures, spinal infection, we look at things like osteoporosis, but also how to pick up some of the inflammatory presentations of back pain as well that may come through clinic. So it's a content-packed day. There's lots of different ways of delivering the content, so we try and make it as interactive as possible. Case studies, there's some lectures, there's some group work, but also there's some practical as well. So we try and take a serious and sometimes a dry topic and make it fun, but also try and ensure that you take something away following the half day or the one-day course to ensure that you've got things you can apply readily on Monday morning to help you pick these patients up and ultimately maintain patient safety.